Thank you.
Calling today's Consumer Protection and Commerce Committee to order. Today is Thursday, April 15th, 2 p.m. in room 329. Welcome everyone to our final CPC hearing for this legislative session. Thank you everyone for being here. Just a couple of reminders before we get started today. Please remember to mute yourselves and to have yourselves muted during the hearing to help us to get through this hearing as expeditiously as possible. And also, if you can also remember, we have a 2-minute time limit. So if you go over the 2 minutes, we will kindly ask you to summarize your testimony. And then as a reminder, also, if you can just remember to show everyone the aloha spirit as we all share our testimony during today's hearing. Once again, thank you to Representative Chair Johansson for allowing me to lead today's hearing on our resolutions. So first up, our resolution on the agenda is SCR 10, which is authorizing the issuance of a term non-exclusive easement covering a portion of state submerged land at Ka'alawai, Honolulu. So the first up to testify is DLNR, Russell Tsuji.
Good afternoon, Vice Chair, Chair, members of the committee. Russell Tsuji for the department. For a number of these shoreline resos, this committee has actually heard the House companion, and so we'll be standing in support of these administrative measures of the department. Thank you. And available for any questions. Thank you.
Thank you. Any questions from the committee? Seeing none, we'll go to our next resolution, SCR 11, authorizing the term non-exclusive easement covering a portion of state submerged land at Waimanalo, DLNR.
Yes, good afternoon, Vice Chair. The department will stand in its testimony in support.
Thank you. Questions from the committee? Seeing none, we'll go to our next resolution, SCR 12, authorizing the issuance of a term non-exclusive easement covering a portion of state submerged lands at Kamaole Kula, Maui. DLNR testifying in support again.
Again, Chair, standing on our testimony in support of the measure. Thank you.
Thank you. Any questions from the committee? Okay, seeing none, moving on to our next one, SCR 13, authorizing the issuance of a perpetual non-exclusive easement covering a portion of state submerged lands at Mauna Lua, Hawaii. DLNR.
Department will stand on its testimony in support. Thank you.
Thank you. Committee, any questions? Okay, moving on to our next measure, SCR 14, authorizing the issuance of a perpetual non-exclusive easement covering a portion of state submerged lands at Kaneohe. To testify, DLNR.
Again, the department will stand on its testimony in support. Thank you.
Thank you. Committee, any questions on this resolution? Seeing none, going on to our next one, SCR 15, authorizing the issuance of a term non-exclusive easement covering a portion of state submerged lands at Napili 2 and 3 on Lahaina, Maui. DLNR.
The department will stand on its testimony in support of the measure. Thank you.
Thank you. Committee, any questions on this measure? Seeing none, we'll go to our next one, SCR 16, authorizing the issuance of a term non-exclusive easement covering a portion of state submerged lands at Waiahuli, Keokea, Kihei, Wailuku, Maui. DLNR.
The department will stand on its testimony in support. Thank you.
Thank you. Committee, any questions on this measure? Seeing none, moving to our next one, SCR 17, authorizing the issuance of a term non-exclusive easement covering a portion of state submerged lands at Waiahuli, Keokea, Homesteads, Kihei, Maui. DLNR.
Cool. Which one are we on? I'm sorry.
17. SCR 17.
Oh, I'm sorry. The department will stand in its testimony in support. Thank you.
Thank you. Committee, any questions on this measure? Okay, seeing none, going on to our next one, SCR 42, authorizing the issuance of a lease covering state submerged lands at Pier 27 in Honolulu Harbor to Atlantis Submarines. First up to testify is the Department of Transportation.
Good afternoon, Vice Chair Lynn Araki Regan from the State Department of Transportation. We stand on a written testimony and support. Thank you.
Thank you. Next up, we have Atlantis Submarines, Ronald Williams.
Good afternoon. I would just like to stand on my written testimony and thank you for hearing it.
Thank you. Committee, that is all the testifiers we have. Are there any questions on this measure? Seeing none, we'll move on to our next measure, SCR 87, authorizing the issuance of a term non-exclusive easement covering a portion of state submerged lands at Ku'au, Hama Kuapoko, Maui. Up to testify is DLNR.
The department will stand on its testimony and support. Thank you.
Thank you. Next up to testify, we have Sandy Wong from See and Believe LLC.
Good afternoon, Vice Chair and Chair and members of the committee. My name is Sandy Wong. I am testifying in behalf of the committee, the applicant in support. We have submitted written testimony, but I am available for questions. Thank you.
Thank you. Next up, we have Leilani Pomano, See and Believe LLC.
Good afternoon, Vice Chair and members of the committee. My name is Leilani Pomano, and I have submitted written testimony in support of SCR 87 on behalf of See and Believe LLC, and we will stand on our written testimony and support. Thank you.
Thank you. Committee, that is all the testifiers we have for this measure. Are there any questions on this measure? Seeing none, we'll go to our next measure, which is SCR 102, authorizing the issuance of a perpetual non-exclusive easement covering portions of state submerged lands at Mauna Lua, Oahu. Up to testify is DLNR.
And the department will stand on its testimony and support. Thank you.
Thank you. Committee, any questions on this measure? Seeing none, we'll move to our next measure, SCR 113, authorizing the issuance of a term non-exclusive easement covering a portion of state submerged lands at Kapa'a, Pawaihao, Kauai. Up to testify is DLNR.
And the department will stand on its testimony and support. Thank you.
Thank you. Committee, any questions on this measure? Moving on to our next measure, SCR 141, authorizing the issuance of a term non-exclusive easement covering portions of state submerged lands at Wailea, Maui. Up to testify first is DLNR.
The department will stand on its testimony and support. Thank you.
Thank you. Committee, any questions on this measure? Seeing none, we'll go to our next measure, SCR 159, urging the Department of Land and Natural Resources to examine and consider purchasing reef insurance to support nature-based solutions to protect Hawaii's coastlines and coastal infrastructure from natural disasters. First up to testify is DLNR. Brian Nielsen, are you here? Nope, not here. They are in support. We also have supportive testimony from the Nature Conservancy Hawaii. Since no one is present to answer any questions, we will move on to our next measure. Our next measure on the agenda is SCR 152, urging the Department of Education to coordinate with the Department of Commerce and Consumer Affairs to implement a graduation requirement of at least a half credit in financial literacy during the junior or senior year. First up to testify is the Department of Education.
Good afternoon, Vice Chair Kitagawa, Dan Miyamoto for the Hawaii Department of Education, representing Superintendent Kishimoto. Department stands on its written testimony and supports the intent with comments. Thank you for this opportunity to testify.
Thank you. Next up, we have Christian Sherrill from Next Gen Personal Finance in support.
Good evening from California. Thank you all for having me, Vice Chair, members of the committee. My name is Christian Sherrill. I represent Next Gen Personal Finance. We are a nonprofit that offers free financial literacy curriculum, teacher PD, and support for teachers, all at no cost, because we believe every student deserves to take a personal finance course. I'm following up my previous testimony at the Education Committee with a response to the comments from DOE. Specifically, Terry Ishijima last week shared, we support the teaching of financial literacy in schools, but then also expressed concerns in her comments that the course shouldn't necessarily be a 1/2 credit course and that there should be some flexibility there. I respect that sort of temptation for flexibility. It's totally understandable. However, many states have gone down the path of sort of placing more flexibility instead of simply implementing a 1/2 credit course. And unfortunately, the results have been very, very poor. So Georgia, Texas, and Florida were the most recent to do this. 0% of Georgian high schoolers, 1% of Florida high schoolers, and 2% of Texas high schoolers take a personal finance class after a few years of implementing a sort of more flexible approach to this. So I just want to urge members of the committee to consider passing 152 unamended. Keep it a 1/2 credit course. That's the only way to guarantee every kid gets this instead of just a lucky few. Thank you.
Thank you, Christian. Committee members, that's all the testimony we have on this measure. Are there any questions? Seeing none, we'll move on to our next measure, SCR 70, requesting the auditor to conduct a sunrise analysis on licensing and their certification of community health workers. First up is the Office of the Auditor.
Good afternoon, Vice Chair, Chair, committee members. Daria Loy-Goto on behalf of the Office of the Auditor. I would just note that this concurrent resolution started as a working group to convening a task force to plan the certification and training process for community health workers. So now we have a resolution before us that calls for a sunrise analysis, but we would point out that there's no corresponding bill that would lay out what the legislature potentially might see in terms of a licensing, a more fully formed licensing plan. So that our testimony with comments is, we certainly would like to assist the committees to do this work, but without a bill, we're concerned that we wouldn't have an idea of what the legislature would like us to analyze in terms of a licensing program in this area. We would also note that in terms of the training request and recommendation that the second part of the bill has, we may not have the subject matter expertise to be able to evaluate what kind of training would be appropriate for a community health worker. So we offer that comment as well. Thank you for the opportunity to testify. I'm available to take any questions the committee might have. Thank you.
Thank you, Daria. Next up to testify, we have Justina Marquez from Ka'u Health Community Association in support.
Thank you for allowing me to give my testimony. I'm the Community Health Worker and Executive Director of Ka'u Health Community Association. And I wanted to make a reference to the Association of State and Territorial Health Officials. There was an article published entitled State Approaches to Community Health Workers Certification, of which I believe is relative to Senate Concurrent Resolution 70 SD1. As the article focused on growing the evidence of supporting the effectiveness of community health workers, the leverage and the role of community health workers for improving health and well-being. Other key policy issues of community health workers that continue to evolve with certification. In 2018, Arizona and Maryland addressed community health workers certification in legislative session and was enacted and directed by the Department of Health Services to implement a community health workers certification program. In Maryland, the governor signed Senate Bill 163 into law. The new Maryland law authorized the State Department of Health to adopt and issue regulations for community health workers, specifying what the initial regulations may cover and allowed for additional regulations of the recommendations of a state community health worker advisory. Under the law, the Department of Health was charged with developing the regulations and procedures for accrediting community health workers training. I sincerely believe both Arizona and Maryland legislative actions are excellent examples for Hawaii to move forward in establishing the community health workers certification and licensure policy. Thank you for letting me share my testimony.
Thank you, Justinine. Please note, committee, we also have other testimony in support as well as comments from various organizations and individuals. Are there any questions for the testifiers? No. Seeing none, we'll move on to our next measure, SCR 191, urging the United States Department of Health and Human Services to amend its policies relating to postpartum sterilization waiting periods for Medicaid recipients. Up first to testify, we have Rennie Soon from ACOG.
Aloha, Chair Johansson, Vice Chair Kitagawa, and committee members. My name is Rennie Soon. I am the chair of the Hawaii section of the American College of Obstetricians and Gynecologists. and we support Senate Concurrent Resolution 191. You have our written testimony, but I just want to highlight a couple of things. First, we want to thank you all for bringing this issue to the table. Most of us OBGYNs, especially those of us whose patient population is mostly insured under Medicaid, deal with this issue on a weekly basis, at least, sometimes more. The 30-day waiting period that is required of Medicaid patients who are seeking permanent contraception or sterilization, it is not a requirement for patients that have commercial insurance. And that's differential access based on income alone to a basic, highly effective method of contraception. It's time that HHS reviews and amends this form to stop perpetuating inequities in access to reproductive health care. Inequities, by the way, that are probably contributing to some of the disparities that we see in maternal morbidity and mortality. Mahalo for opening the dialogue about this issue. And we want to really urge HHS to do so as well. So please support SCR 191. Mahalo.
Thank you, Dr. Soon. Next up, we have Madeline Macon testifying in support.
Hi, good afternoon, Representative Gawa, Representative Johansson, and committee members. Thank you so much for the opportunity to testify today in strong support of SCR 191. My name is Madeline Macon, and I'm a maternal fetal medicine fellow at the University of Hawaii. And even in my relatively short 6 years of training in obstetrics, gynecology, and perinatology, I've been forced several times to deny the critical service of postpartum sterilization to patients based solely on their public insurance status and the restrictive nature of the Medicaid Title 19 sterilization consent form. In stark contrast, I've provided sterilization for patients who, despite having every resource possible, face no barriers in accessing this form of contraception. Privately insured patients can literally decide the same day they give birth that they want a sterilization, and they are not subjected to the same strict consent parameters. And this two-tier system of access propagates health disparities. We have a long history of racial injustices in medicine and society as a whole. And although the initial intent of these federal policies was to prevent abusive sterilization practices, they have since erected significant barriers for the women that they intended to protect. So the solution to preventing reproductive coercion is not to make it harder for disadvantaged women who want sterilization to get it. Rather, we have to ensure an informed consent process that supports different levels of health literacy, language concordancy, and reproductive autonomy. And it's not a coincidence that Black, Indigenous, and other women of color experience unintended pregnancy and related complications, and even maternal death at alarmingly higher rates. Closer to home, recently the Hawaii Maternal Mortality Review Committee found that Native Hawaiian and other Pacific Islander women make up nearly half of all maternal deaths in the state, even though they only make up 20% of all women in the state. So it is long overdue that we re-examine these discriminatory regulations. We must amend health policy that will actually support low-income patients in their ability to exercise the same degrees of reproductive autonomy as that of their privileged counterparts. Thank you so much.
Thank you, Dr. Macon. Next up, we have Kevin Psyche testifying in support.
Good afternoon, Vice Chair and members of the committee. Thank you for the opportunity to testify. My name is Kevin Psyche. I'm also a practicing maternal fetal medicine fellow here in Honolulu. I stand with my colleagues today in strong support of SCR 191. And would like to tell you that the federal regulations on postpartum sterilizations that are solely applied to Medicaid insured patients, they serve as barriers to reproductive healthcare access and propagate inequities in health outcomes in low-income women and women of color. These groups are already suffering from increased rates of maternal mortality, as my colleague has mentioned, and we need to do everything we can to give them access to high quality care that they deserve. Thank you for the opportunity to testify in support of this bill. I'm available for questions.
Thank you, Dr. Psyche. Committee, any questions for the testifiers? Please also note that we have additional testimony in support from 4 different individuals. Seeing no questions, we will move on to our next measure, which is SCR 219, urging the Executive Office on Aging to form a working group and develop a plan for outreach to Kupuna to remediate a lack of digital literacy, broadband access, and computer equipment. First up to testify, we have Debed Bertlam.
Aloha, Vice Chair, members of the committee. My name is Bert Lum. I'm the strategy officer for broadband, and we stand on our written testimony in support of this resolution. I might also add that DBED recognizes the limited resources available to the Executive Office of Aging to develop an outreach plan to Kupuna, and in the spirit of collaboration, welcome participation in the broadband Hui, where we can share resources and collectively achieve our mutual digital equity goals. So I just wanted to mention that, and I'm available for any questions. Thanks for allowing me to testify.
Thank you, Bert. Committee, please note that we have comments submitted from the Executive Office on Aging and supportive testimony from various organizations as well as individuals. Does anyone have a question for DBED?
I do.
Okay, Representative Maurico.
Thank you. I guess, Bert, it's so funny that I would get an email this morning from a constituent telling me that we should think about the elderly who are not familiar with technology, don't have a phone that can do it or an iPad. So they depend a lot on relatives, right? Now with the Safe Travels program, they're concerned that, everything is online. How can they get assistance to fill out a form because they want to be able to travel again, but everything is online, and to download the results of your tests and all of that. It's a consideration that I think we really should take seriously now because it's happening now. So I guess the intent would be, can the Office of Elderly Affairs help with the computer, or maybe libraries or county neighborhood centers to help these people get, the online application filled out and assistance in uploading results and such. And it's not something we can wait, right?
Yeah, thanks, Representative. I mean, that's a great question. So what we are finding is that there are a multitude of programs, and I'm actually working on one right now called the Emergency Broadband Benefit, which also requires folks to actually sign up for this benefit. And the intent is that we are actually now reaching out to a lot of the nonprofits that actually are on the front line of supporting a variety of different, let's say vulnerable or communities that are isolated and perhaps maybe even disenfranchised. So, we're working with folks like AARP and helping to get the word out. And in the process of not only, this program to help Kupuna with digital literacy, with other programs like this Emergency Broadband Benefit, I think we can dovetail off the work that we've already been doing with the Broadband Hui, identifying some of the nonprofits that are in front of these communities. And I think together we can help the Executive Office of Aging realize that there are other resources that we can perhaps tap and help those communities that are most needy. So I think, collectively we can achieve these goals. And that's what I wanted to mention, that it's not solely on the shoulders of the Office of Aging. I mean, we can kind of like get the community behind it, and there's multitude of projects, and we are here to try to get everybody to hand in hand support this effort.
Very good to see someone out in front of this. Thank you very much.
Thank you, Representative. Any other questions from committee members? Okay, seeing none, we'll move on to our next measure, SCR 239, urging the Department of Transportation to increase the use of reclaimed asphalt pavements to repave, reconstruct, and preserve state streets, roads, and highways, and explore use of other products using reclaimed asphalt. First up to testify, we have the Department of Transportation.
Good afternoon again, Vice Chair, Chair, and members. Lena Raki-Regan from the State Department of Transportation. We stand on our written testimony supporting the intent and offering comments. Thank you.
Thank you. Next up, we have Oahu Motorsports Association, Lee Kobian.
Yes, hello. Can you hear me?
Yes, we can hear you.
Okay. Lee Kobian, I'm the president of the Oahu Motorsports Association, and we stand with our testimony supporting resolution 239. We like to ask the committee if there's a way that they can expand this to include county roads and county projects. As it's written right now, it just says state roads. I was on the Parks Board for about 8 years, and we had a project in Hilo resurfacing the racetrack, and it was about $5.2 million. And I think if it was a county project under the Department of Parks and Rec. We use if we use reclaimed asphalt, I think it was going to be a lot cheaper. And we want to see if it's possible if we can expand this resolution to include county roads and county projects. And thank you for allowing us to testify.
Thank you. Committee, any questions for the testifiers? No? Okay, seeing none, we will go on to our final resolution, SCR 241, establishing a sister state relationship between the state of Hawaii, United States of America, and the prefecture of Yamaguchi, Japan. First up to testify, we have Deben.
Aloha Chair, Vice Chair, committee members, Dennis Ling for DBED Director Mike McCartney. DBED stands in strong support of this resolution. Thank you very much for the opportunity to testify.
Thank you, Dennis. Any questions from the committee? Seeing none, I'd just like to tell everyone thank you for coming to testify, and a special thank you I forgot to mention earlier to Russell Suji from DLNR, who was available to testify on numerous measures that we had on today's agenda. So we will recess now for decision making. Reconvening today's 2 p.m. CPC hearing for all of our resolutions. We are now going to be voting on the resolutions before us. First up on the agenda, SCR 10. The recommendation is to pass this measure as is. Committee members, any comments or questions? Seeing none, Chair, if you can take the vote, please.
Sure. The recommendation of the chair is to pass SCR 10 unamended, noting the Chair and Vice Chair vote aye. Representative Aquino, Representative Har,
Aye.
Representative Hashem, Representative Kong,
Aye.
Representative Mizuno is excused, Representative Morikawa,
Aye.
Representative Onishi,
Aye.
Representative Tarnas,
Aye.
and Representative Matsumoto. Thank you. Chair, your measure is adopted.
Thank you. Next up, we have SCR 11. The recommendation is to pass as is. Committee members, any comments or questions? Seeing none, Chair, if you can take the vote, please.
Okay. The recommendation on SCR 11 is to pass unamended, noting the excused absence of Representative Mizuno. Are there any reservations? Are there any noes? Chair, your recommendation is adopted.
Thank you. Next up, SCR 12. The recommendation is to pass as is. Any comments or questions? Seeing none, Chair, if you can take the vote.
Okay, the recommendation of the chair on SCR 12 is to pass the measure unamended, noting the excused absence of Representative Mizuno. Are there any reservations? Are there any noes? Okay. Chair, your recommendation is adopted.
Thank you. Next up, SCR 13. Recommendation is to pass as is. Any comments or questions? Seeing none, Chair, if you can take the vote, please.
The recommendation on SCR 13 is to pass the measure unamended, noting the excused absence of Representative Mizuno. Are there any reservations? Are there any noes? Chair, your recommendation is adopted.
Thank you. Next up, SCR 14. Recommendation is to pass as is. Any comments or questions? Seeing none, Chair, if you can take the vote, please.
Recommendation of the chair on SCR 14 is to pass the measure unamended, noting the excused absence of Representative Mizuno. Are there any reservations? Are there any nays? Chair, your recommendation is adopted.
Thank you. Next up, SCR 15. Recommendation again is to pass as is. Any comments or questions? Seeing none, Chair, if you can take the vote, please.
The recommendation of the chair on SCR 15 is to pass the measure unamended, noting the excused absence of Representative Mizuno. Are there any reservations? Are there any noes? Chair, your recommendation is adopted.
Thank you. Next up, SCR 16. The recommendation is to pass as is. Any comments or questions? Seeing none, Chair, if you can take the vote, please.
The recommendation of the chair on SCR 16 is to pass the measure unamended, noting the excused absence of Representative Mizuno. Are there any reservations? Are there any noes? Chair, your recommendation is adopted.
Thank you. Next up, SCR 17. Recommendation is to pass as is. Any comments or questions? Seeing none, Chair, if you can take the vote, please.
The recommendation of the chair on SCR 17 is to pass the measure unamended, noting that Representative Mizuno will be excused for the rest of the vote taking. Are there any reservations? Are there any noes? Chair, your recommendation is adopted.
Thank you. Next up, SCR 42. For this measure, we will be deferring this measure because this morning WAM Committee and the Senate passed out the concurrent House Resolution HCR 49. Moving on to the next measure, SCR 87. Recommendation is to pass as is. Any comments or questions? Seeing none, Chair, if you can take the vote, please.
The recommendation of the chair is to pass SCR 87 unamended. Are there any reservations? Are there any noes? Chair, your recommendation is adopted.
Thank you. Next up, SCR 102. The recommendation is to pass as is. Any comments or questions? Seeing none, Chair, if you can take the vote, please.
The recommendation is to pass SCR 102 unamended. Are there any reservations? Are there any noes? Seeing none, Chair, your recommendation is adopted.
Thank you. Next up, SCR 113. The recommendation is to defer this measure as WAM has passed out the concurrent resolution HCR 166. The next measure, SCR 141. Recommendation is also to defer this measure as WAM has passed out the House concurrent resolution HCR 89. For all of these measures, I'd just like to thank Chair Tarnas, who has worked hard with DLNR to make sure that these measures are ready and have moved forward. So thank you, Chair Tarnas. Next up, SCR 159. The recommendation is to pass this as is. Are there any comments or questions? Representative Morikawa.
Just a comment. I mean, I have reservations on this, but only because Hawaii is such that we're surrounded by reefs and ocean waters, and it would be very costly, but I know it's just to look at it. Thank you. Reservations.
Thank you. Any other comments or questions? Seeing none, Chair, if you can take the vote, please.
Okay, the recommendation of the chair is to pass SCR 159 unamended. Noting the reservations of Representative Morikawa, are there any other reservations? Representative Kong? Okay, are there any noes? Okay, seeing none, Chair, your recommendation is adopted.
Thank you. Next up, SCR 152. The recommendation is to pass as is. Are there any comments or questions? Okay, seeing none, Chair, if you can take the vote, please.
The recommendation of the chair on SCR 152 is to pass the measure unamended. Are there any reservations? Are there any noes? Seeing none, Chair, your recommendation is adopted.
Thank you. Next up, SCR 70. Community workers, as you know, this resolution, I think, pointed out just how important community workers are in their role in the healthcare system, especially on neighbor islands and rural communities. And I'd like to note that the testimony of the Hawaii Public Health Institute, both in this hearing and in the previous Senate hearing, stated that they've convened a network of community health workers as well as allies dedicated to supporting community health workers to address this issue that's being discussed in this resolution. And I'd like to encourage the Hawaii Public Health Institute to work with the introducer of this measure during the interim to move this issue forward next session. And as CPC is the final committee that will hear this measure, and I believe that there's still concerns with the way that this measure is written, my recommendation is to defer this measure, as I think there's still work that needs to go on before we can pass that. So recommendation is to defer SCR 70. So we'll move on to the next measure, SCR 191. The recommendation is to do House Draft 1 on this, and it's simply to add certified copies of this resolution to be sent to the Department of Human Services Director here in Hawaii, as well as the Hawaii Medicaid Director, who's the administrator of the MedQuest division. Any comments or questions on the amendments to this measure? Seeing none, Chair, if you can take the vote, please.
Okay, the recommendation of the chair on SCR 191 is to pass this measure with amendments. Are there any reservations? Any noes? Seeing none, Chair, your recommendation is adopted.
Thank you. Moving on to our next measure, SCR 219. Based on testimony, I will be making a couple of edits to this resolution. So first off, we'll be amending on page 2, starting at line 27. We're going to be replacing some of the text there. So that section will state that the legislature requests that the broadband hui is urged to include a representative from the Executive Office of Aging as a member of the hui to represent the needs of kupuna in regards to digital literacy, broadband access, and computer equipment. We'll also be removing the following 3, be it further resolved, that are in this resolution, starting on page 2, lines 32 to 42, and then page 3, lines 1 through 7. And then we will be also adding in a copy that this resolution be also sent to the Director of DBED as well as the broadband. Are there any comments or questions? Oh, we'll also be changing the title, sorry, to match the amendments that have been made. Are there any comments or questions? Okay, seeing none, Chair, if you can take the vote, please.
The recommendation of the chair on SCR 219 is to pass with amendments. Are there any reservations? Any noes? Seeing none, Chair, your recommendation is adopted.
Thank you. Next measure, SCR 239. The recommendation is to pass this measure as is. Are there any comments or questions? Seeing none, Chair, if you can take the vote, please.
Okay, the recommendation of the chair on SCR 239 is to pass this measure unamended. Are there any reservations? Any noes? Seeing none, Chair, your recommendation is adopted.
Thank you. And our last measure on today's agenda, SCR 241, the recommendation is to pass as is. Any comments or questions? Seeing none, Chair, can you take the vote, please?
The recommendation of the chair on SCR 241 is to pass unamended. Are there any reservations? Any noes? Chair, your recommendation is adopted.
Thank you. And thank you everyone for being present today. Thank you to the committee members for being here. This adjourns our final CPC committee hearing for this legislative session. Adjourned.